You're listening to RazorCast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.
Hello, everyone. This is Liz Harvey coming to you from our RazorCast studios in New York City, where we are dedicated to bringing you top-quality advice from many of the leading expert professionals across the U.S. In today's episode, we are speaking with Dr. Igor Kaplansky. Dr. Kaplansky is the founder of Dentistry by Dr. Kaplansky in Gasport, New York. He grew up in Russia, and after receiving his dental degree, he was accepted into the International Dentist Program at the University at Buffalo School of Dental Medicine. He graduated cum laude in 1998 with a Doctor of Dental Surgery degree and continued as a resident in the Advanced General Dentistry Program at Buffalo. Since 1999, Dr. Kaplansky has been practicing family dentistry with a special interest in orthodontics and dental implants. He has been recognized with prestigious fellowship awards from the Academy of General Dentistry and the International Congress of Oral Implantologists. Dr. Kaplansky is widely considered to be one of the top dentists in the country, and he is also a contributing member of our national network of industry professionals. Today we're going to talk about a very important topic, orthodontics. Hi, Dr. Kaplansky. How are you today?
I'm well, Liz. Thank you. Thank you for having me.
Oh, well, it's great that you're here with us, and I'm going to dive right into the first question. Who needs orthodontic treatment?
Orthodontic treatment is a wonderful way to change a person's appearance. And mostly it's associated with children. Mostly you hear about kids, teenagers getting braces, but many adults choose to correct their smile later in life, and that works very well, and it lasts them a lifetime after that. Orthodontic treatment mostly is started, it's better to start it earlier, because when the person is still growing, it's easier to move teeth than when they're done growing, but it can be done at any age.
Okay, great. And that leads into the next question I was going to ask, is what age is appropriate to start receiving orthodontic treatment, and then is it ever too late?
Excellent question. Like I said, the best time to start orthodontic treatment is while the children are still growing. That way the growth can be guided, and a lot of times teeth extraction can be eliminated. Once the individual is done growing, the facial growth is complete. If they have crowding, in order to correct that and create room, sometimes teeth have to be extracted, which is not a problem, but it can be avoided if treatment is started earlier. That's why nowadays we look into kids' mouths very differently, and we don't just pay attention to cavities and their hygiene, but we also look at their bad bites. And if we notice a bad bite early, it can be started. Treatment can be started and can be corrected much more easily than if they started later. But as far as what's the latest that you can start treatment, I've had patients in their late 60s start treatment, and when they were done, they were very happy. So it can be pretty much done at any age.
That's great. And I understand you offer Invisalign. Can you tell us what that is?
Invisalign is a great new way to move teeth without wires, without metal, without braces. It's a series of clear aligners that patients wear on their teeth 24/7. They only remove them to eat and brush. It's a removable appliance. It was originally designed for adults because you rely on patients' compliance a lot. So the success of Invisalign treatment greatly depends on patients' cooperation. But in the recent years, they have expanded this treatment modality into teenagers as well. So we successfully treat adults and teenagers with Invisalign. So Invisalign doesn't work for everybody. Careful case selection is very important, but for cases where it's indicated, it's a great way to correct malocclusions or bad bites.
All right. And how long do people wear orthodontics? what's a typical cycle? Like how many months or years?
Yes. That depends obviously on the severity of their bad bite or malocclusion. I would say that the average treatment time for children is about 1.5 to 2 years. On adults, it may be slightly longer because the growth is finished, the bone is denser, it is slightly more difficult to move teeth, but average time in my practice is still about 2 years for children or adults.
Okay, and after braces are removed, what is the follow-up treatment like? What can people expect?
This is very important. Most people, unfortunately, either are not explained that from the beginning or maybe don't understand the concept of retention. Retainer wear is extremely important after treatment is complete. Human teeth, bones, ligaments, gum tissue, everything has a lot of memory built into it. So when we move teeth to their new positions, they always tend to want to return back to their original places. And when treatment is finished, retainer wear is extremely important. Retainers can be fixed or removable. We make retainers, usually we make upper retainers that are removable, and lower retainers are what's called a forever bar. It's a small little piece of wire that's bonded to the back of lower front teeth, and it keeps those teeth straight throughout life. And when people patients ask me, when can I get rid of this, when can I remove this, I said, as soon as you're ready for your teeth to go crooked again, you remove your retainer. So retainer wear is pretty much forever. Mm-hmm. Other cases where people don't wear retainers and their teeth remain straight, sure. But would you like to take that chance? Would you like to take that risk? That's the question. So in my book, it's better to have a retainer. It's like an insurance policy against teeth going back crooked.
Okay, great. This has been very helpful. Thank you so much, Dr. Kaplansky. We know you're really busy, so I just want to thank you for your time and help.
Thank you, Liz. My pleasure.
And for our listeners across the country, if you are interested in speaking with Dr. Igor Kaplansky, you can either go online at www.drkaplansky.com or call 716-772-7500 to schedule an appointment. And on behalf of our entire team at Razorcast, we want to thank you for listening, and we look forward to bringing you more top-quality content from our country's leading industry professionals.
You've been listening to Razorcast, USA's hottest podcast, bringing you cutting-edge interviews from leading industry professionals.